essentially science and as a consequence treatment has moved on. So if you look back to the last century, what happened was a diagnosis of AIDS meant a death sentence, at least at the beginning, and people were infectious, so we had to protect our patients. But now, once you've had a good diagnosis, you go on to treatment and the risk is not there. People who are on effective treatment have negligible levels of virus and will not be infecting. They just won't infect patients. So it's very important that these people go back to work. But we had to wait until the science caught up with where we need to be. So essentially what's happened is that HIV has become a long-term condition now, and these people are not an infection risk to patients at all.
Well, OK, let's be absolutely clear on that, because it's the thing people will most want to know. There is no risk, or it is a risk that you have judged to be acceptable?
The Scientific Advisory Committee say that the risk ranges from 1 potential infection per 40 years to 250,000 years. So the risk is negligible when you consider all the risks that we face as patients. So the risk is akin to zero, but you never have a zero risk.
And this is a clinical decision you've taken. I mean, what do you think people will make of it? Will you understand if individually people are, I don't know, still concerned about this?
Well, clearly the government was concerned, I was concerned, which is why we asked an expert committee to look at it, and they've spent from 2007 to 2011 poring over the international evidence, looking for evidence of infectivity in this way, and watching how treatment works and the infectivity of people who are on effective therapy. And they have concluded that we should move in this way. And looking at it, I think this is right, because we must stop stigmatising HIV. The people who know they've got it take effective treatment. It's a long-term condition and they should be safe for patients. And what I do want to emphasise to you and everyone is, of course, we're not saying, hey, take your treatment and get on with it. They are going to be monitored every 3 months, and if their virus load goes up at all, there will be a careful discussion, and if there's a risk, they will be excluded again until they have effective treatment.